All right, hello guys, welcome back to the channel. How are you guys doing? In today's video, we are going to be looking at a question once again from my student, a question that was blundered by my students. You guys are on YouTube, you guys are actually fortunate. You get to see the questions that one or two of my students struggled with, and I get to highlight why they struggled with it, and then you can learn from it and you can become better, which is good for you. Again, you can pause the video here, you can try to answer the question. What did you pick as an answer? You can put your answer down in the option. Let me know what your thought process was, maybe why you picked the answer, why you thought what you thought, and we are going to jump into this question. This question is the one question that is descriptive or representative of the feeling that a lot of students get when they read finance. So I'm going to try to address this question like a typical student, okay? Now, the average student begins this this way. I hope you have your answer already because I'm jumping right into the question already. Okay, a 25-year-old man comes to the clinic due to a 3-month history of right shoulder pain. Kennedy has taught us the principle that when you read the first line of the question, you pause. For those of you that are going to have access to test-taking mastery, you will hear this emphasized a lot in test-taking mastery. And you're probably going to be referred back to these videos as well. This video series I'm going to be making on YouTube to look at it. So brace yourselves and begin to learn these principles and apply them in your own studies, okay? 3-month history of right shoulder pain. Now you're supposed to come up with differential diagnosis. And a lot of you are going to say, well, I don't know. He just has shoulder pain. Did he hit his shoulder somewhere? Maybe. Did he perform some form of activity where that involved repetitive use of the shoulder? This is the kind of question you need to be asking yourself. He also has swelling and pain at his heels. Okay, now pause. He has shoulder pain. You were thinking to yourself, maybe he does some kind of sports, some kind of activity, something that involves him using his shoulder excessively. Maybe he slept wrong. A lot of things could be causing a person to have shoulder pain. But they also said he had swelling and pain at his heels. For the purpose of allowing you guys being able to follow along with this question, I'm not going to just jump straight to what everything is, because if I start doing that, then you may not be able to learn. But let's assume that we are not sure what is going on here. Why does he have shoulder pain? Why does he have swelling and pain at his heels? Your heels, I hope you know where your heels are. Behind your leg, down here. All right. The patient has tried using a topical arthritis cream without improvement, although the over-the-counter analgesics have provided some relief. Analgesics, OTCs, NSAIDs, maybe ibuprofen kind of thing, have helped him. Medical history includes influenza pneumonia at age 12, probably useless to this, but he has otherwise been healthy, takes no regular medications. The patient does not use tobacco, alcohol, or illicit drugs. His temperature is normal, blood pressure is normal, pulse is fine and regular, respirations are normal. On examination, there is pain with resisted abduction at the shoulder and tenderness at the acromioclavicular junction. On examination, there is pain with resisted abduction. Abduction. I hope you remember that abduction is when you pull away from the body. And adduction, A-D-D, abduction, right? So there is pain with resisted abduction. So what are the muscles that play a role in abduction? Do you remember the first 15 degrees? I hope you're saying supraspinatus or infraspinatus, deltoid, right? You remember the muscles that play a role in abduction. Your infraspinatus, your deltoid, your trapezius, 15 degrees, 100 degrees, and above 100 degrees. All right, if there is pain with resisted abduction, then it means that one of these, did I say infraspinatus? That should be supraspinatus. I hope I'm not mixing it up myself. Now, if there is pain on resistance to abduction, it means that there is a problem with one of the agents, because they didn't tell us the degrees, right? One of the muscles or tendons that play a role in abduction. Do you get it? Whenever there is pain in performing a particular type of motion, it means that there is a problem with whatever is responsible for performing that motion. Okay, again, it's just part of the shoulder pain. We don't know. So why does he have pain with one of these muscles or inflammation of one of these muscles? Palpation over the heels iliac crests and tibial tuberosities also elicits tenderness. Palpation over the heels, the iliac crests, and tibial tuberosities also elicit tenderness. Which of the following is the most likely diagnosis in this? Okay, which of the following additional findings rather is most likely in this patient? This is the type of questions that when a lot of students read, they are not going to be able to come up with what the diagnosis is because it's not classic presentation. The diagnosis here is not usually presented like this in vignettes. And so when my student, for example, read this question, my student picked positive rheumatoid factor. And did you also pick positive rheumatoid factor? I want to know how many of you picked that answer. You can let me know in the comments. And while you're done there, please give this video a thumbs up and subscribe if you're not yet subscribed. She picked positive rheumatoid factor, meaning that she was thinking that this patient had rheumatoid arthritis. What did you diagnose this patient with? Let me know in the comment as well. So my student thought that this patient had rheumatoid arthritis, and as a result, she picked positive rheumatoid factor. Before we get to the answer, I quickly reminded my student, you have to look at the options and ask yourself, well, if I pick, there are many times you're going to see two options that mean the same thing on your exam. It's one of the things you learn from test taking mastery. Two options that are almost exactly the same. Why should you pick one over the other? And in this case, my student failed in remembering that principle. Why should you pick positive rheumatoid factor but not subcutaneous nodules? That should make the alarm bells go off. Maybe rheumatoid arthritis is wrong, because in rheumatoid arthritis, yes, you could have positive rheumatoid factor, and yes, you could also have subcutaneous nodules. So when you see two options like this, it means you probably shouldn't pick either of them as the answer, except in special cases, of course. So that rules out option C and option D. Again, if you are one of those students that you don't know what to do, this is one way to rule out options that mean the same thing. Two options, three options that are literally the same thing. You should probably not pick any of them, right? Positive rheumatoid factor is seen in rheumatoid arthritis. Subcutaneous nodules is seen in rheumatoid arthritis. So we should probably not pick rheumatoid arthritis. Hand joint deformities is also seen in rheumatoid arthritis. Which of them is most likely? You probably don't know. I don't know myself, right? Which of them is most likely? All three are found in rheumatoid arthritis. Does that not suggest that perhaps this patient does not have rheumatoid arthritis? The other idea you're going to learn in test taking mastery is looking for clues in the vignette. I want you to do a quick mental search. In all your studies, have you seen, do you remember the only place on your step 1, as far as USMLE step 1 is concerned, where you talk about pain related to the iliac crests? Pain related to the iliac crests. So sometimes when you don't know the answer to a question, I'm approaching this question like a typical student here. You've read this vignette, you don't know what is going on, you're lost, you're not sure what the diagnosis is, because truly the diagnosis is not very obvious to the average student, okay? You look for clues in the vignette. Where in all of your studies can you think of pain, inflammation related to the iliac crests? Does anything come to mind? What if I remind you, okay, the sacrum and the iliac crest? Does this make a little more sense? Are you thinking of sacroiliitis? Are you thinking of sacroiliitis? And if you are thinking of sacroiliitis, do you now know what the diagnosis is supposed to be in this case? I hope all of you arrived at a diagnosis of ankylosing spondylitis. Ankylosing spondylitis. Then somebody will say, oh, Kennedy, but I don't remember ankylosing spondylitis looking like this. Yes, one of the findings you have in ankylosing spondylitis that we don't mention all the time is enthesitis. Enthesitis, inflammation, pain from the tendons and the ligaments. From the tendons and the ligaments. And that was what they emphasized in this vignette. So you see them talk about the shoulder pain, so the ligaments and tendons of those, muscles, those muscle tendons are inflamed. The heels, your Achilles tendon, inflammation, enthesitis, the iliac crest, the tuberosities, all of these are points of attachment and places where we have ligaments. So we have widespread ligamental inflammation going on in this patient. This is what we call enthesitis. And enthesitis is a key feature in ankylosing spondylitis. Now that you know the diagnosis is ankylosing spondylitis, have you come up with the answer? Yes, the correct answer here is going to be limited spine mobility. The correct answer to this question will be limited spine mobility. You would remember that in persons with ankylosing spondylitis, one of the classic findings is bamboo spine. Of course, they also have anterior uveitis. They have sacroiliitis. They have aortic regurgitation. They have enthesitis. They have dactylitis. If you remember these information, then you know the classic presentation and finding in a person with ankylosing spondylitis. The diagnosis here is ankylosing spondylitis, and limited spine mobility is going to be unique to that condition. Some of you may have picked proteinuria. If you thought that this young man had SLE, then you might have picked proteinuria, right? SLE is going to cause joint pain, but SLE would not classically present with limited ligamental inflammation or with purely just enthesitis by itself. If this was SLE, we would have more composite findings, more presentation, more symptoms in this patient. And now, just to summarize and to give you a little more information before you go, take note of this. Remember that when they give you an elderly patient with low back pain, you should think of a number of things. Think of osteoarthritis. Think of multiple myeloma. Think of vertebral TB, which we call Pott's disease. And there are two more. One is a malignancy. Do you remember what those two are? One is a malignancy that's metastasized to the lower back. And tell me in the comments what the other two big differentials are. If you're not sure of them, head on to the Instagram page. If you do a little scrolling, you will see a post on that. However, when they give you a young patient, generally he'll be less than 40 years old, with low back pain, on the USMLE, there is one big differential I need you to know, and that is ankylosing spondylitis. Right? Ankylosing spondylitis. A number of other things that you can think about is disc herniation, spondylolisthesis, but I don't want you thinking of those, right? I need you to have, so you can put spondylolisthesis. You can think of your disc herniation, but these are minor. I need you to remember, very importantly, once they give you a young male patient or a young patient with low back pain, think ankylosing spondylitis. That is the classical presentation, a young patient with low back pain. Now, this question that I showed you guys today is not a classic presentation for ankylosing spondylitis, but you see it is a question nonetheless. So you need to remember the other parts of ankylosing spondylitis. Enthesitis is very important. Students miss it all the time. My students missed it, and I hope you will not miss it. Good luck on your exams. Remember to like, remember to subscribe, and please share this video and help someone else as well get better. Until next time, this is Study with Kennedy, and I will see you guys soon.